Good morning. Convening the Committee on Health and Homelessness. Today is January 24, 2024, 9 o'clock a.m. in conference room 329. Members, thank you for joining us early in this morning and early in the legislative session. Today we have an important update and briefing to educate the committee and the public about the Maui Wildfire Exposure Study. This is a collaboration between the University of Hawaii Economic Research Organization, the College of Social Sciences, JABSOM, Cancer Center, and numerous community-based organizations such as Roots Reborn, Maui Medic Healers Hui, and Malama Kula. We're here to discuss and learn more about the cohort study as well as the health registry that the UHERO team is spearheading with respect to the Maui wildfires. Maui will be top of mind for this committee and for all of the committees, and I think it's really important for us to learn what's happening to be able to better understand the health impacts of this disaster. Turning it over to our first speakers, we have Dr. Alika Manakea, professor at JABSOM School of Medicine, Dr. Ruben Juarez with UHERO, and Dr. Carl Bonham, Executive Director of UHERO. I'll turn it over to you and let you folks take it over.
So, hola, aloha. I'm Ruben Juarez. I'm the HMSA Professor in Health Economics at UHERO and also the Economics Department. I'm a member of the Health Policy Initiative at the College of Social Sciences, and I have a privilege to serve as the co-founder and treasurer of the Hispanic Chamber of Commerce Hawaii. So over the last 16 years, my passion has been dedicated to serving Hawaii's minority populations in the state, including Native Hawaiians, Pacific Islanders, as well as a significantly understudied Hispanic population, using data-driven approaches that span multiple disciplines. So today, I want to express my appreciation to Representative Velari and the members of this committee. Thank you for taking the time to meet with us to engage in a conversation about how we can lend our expertise to support Maui's community. So I also want to extend our gratitude to the incredible community partners, many of whom you'll hear from there today.
Aloha mai kako. Mahalo again, Representative Velari and committee members for making the time for us to share our work with you today and discuss how we can strategically support the state in helping our Maui community recover by monitoring environmental exposures and health among those that have been affected by the wildfires. Now, before I begin, I want to introduce myself by first saying I'm both a community member and a scientist, and these things often go hand in hand in my profession, including the work I'm about to present. I was born and raised in Waianae, in a very traditional Native Hawaiian household on homestead land in Nanakuli. My family has very strong roots here, going back Makava Kahiko. I grew up appreciating the connection between the health of the environment and human health, which was instilled in me by my ohana. So not surprisingly, I'm a professor of epigenetics at the University of Hawaii, and my lab focuses on understanding how the environment affects our genes at the molecular level, and how this relates to diseases of health disparities that are pervasive in the state, especially among Native Hawaiians and Pacific Islanders, and prevention. Now, this work involves multidisciplinary approaches and cohort studies, where Dr. Ruben and I, along with other members and collaborators, including community partners beyond the university, have been engaged in it with various communities across the state. We list a few examples here, ranging from projects to address COVID-19 to chronic health conditions such as diabetes, and have in total engaged over 50,000 individuals in research and health with federally funded qualified health centers, schools, and various community-based community organizations. As you know, the recent wildfires on Maui left behind a tragic wake of challenges communities there continue to face. We know hundreds of lives were lost, thousands of people were displaced, and damages to property and the environment have been devastating. While there have been many areas of Maui affected, shown here in red on the left, zooming in on Lahaina here on the right shows how diverse the population is, which highlights unique needs and barriers to care. In addition to our Native Hawaiian and Filipino population, there is a much higher Hispanic and Latino population per capita and immigrant residents than any other part of the state. Each of these populations will have varying degrees of risk for short and long-term health conditions because of the wildfires. However, we currently do not know the full extent of that. From data collected after the tragic events of 9/11 and the California wildfires, for example, we can expect, however, that individuals impacted by the wildfires are likely to experience short and long-term health conditions, including some of these listed here. What we also know is that these diverse populations I described earlier already suffer from higher risk than the overall state population to chronic disease conditions. We call this health disparities, which I have dedicated my life to resolve. My personal conviction to better understand and address these health disparities come from being raised by my great-grandmother, Kupuna Catherine Mauna Kea, who herself was born in Kula and wrote the song Aloha Lahaina. As a native healer, or kahuna la'au lapa'au, I feel her legacy continues in us as health researchers working with community partners to help assess and monitor the health and well-being of those impacted by the wildfires now and in the long term. To do that, we initiated the Maui Wildfire Exposures Study, or Maui WES, to recruit a cohort of 1,000 adults affected by the wildfires. Our aim is to assess the social and health impacts. This will involve collecting both social and biomedical data with annual follow-ups with each participant as illustrated here. We anticipate data collection over 10 years to evaluate long-term impacts such as cancer risk, which is contingent on funding. However, we are very grateful to start the first phase of this work with funding from the Hawaii Community Foundation from the Maui Strong Fund. Our first data gathering event is planned for this Friday, where we will invite adult residents on Maui who have been affected by the wildfires and plan to remain residents for the foreseeable future to complete a comprehensive survey and biomonitoring assessments annually over at least the next 5 years. In addition to some of the data that listed here that we'll be collecting, such as food security, social support, etc., we will also ask participants of this cohort permission to collect their biospecimens, which include urine, saliva, and a little bit of blood. This will be used to measure biological indicators of stress response, including inflammation, as well as environmental toxins that they may have been exposed to. From blood samples, we'll also perform point-of-care tests to determine whether a participant might be at risk for a medical emergency, and we'll be able to refer them to care using our networks of service providers. We'll also be able to give participants a simple health exam, which includes an assessment of lung, cardiovascular, metabolic, and mental health, and ask them permission to release their medical records so we can determine cancer risk. Now, as a small mahalo for participating, each participant enrolled in the study is given $100 per collection. Now, this work is unique and is likely the most comprehensive study to evaluate short and long-term health to date following a natural disaster in the state. But I would like to emphasize that this is not just a research study. In fact, we feel strongly that the health-related data we collect from participants be shared with them and the overall community. In this way, we provide a critical service. I mentioned the results of the health exams will be shared with each participant on the spot, but in addition to that, we intend to share the test results of the biospecimens collected as we get them, which will take a longer time to complete. To facilitate this data sharing, we built a wildfires exposure data dashboard system that allows each participant to securely access their own personal data along with a summary of any of the anonymized data we've collected from the cohort overall. We will also provide a list of relevant community services or providers they can follow up with if needed. In addition to that, we have a robust community advisory board that will help us vet information on this platform for accessibility and clarity because we all share common values of access, transparency, and reciprocity. In addition, we have a diverse, multidisciplinary scientific advisory board to ensure that the data collected remains scientifically robust and informative. We also anticipate that this data can be combined with other data being collected around environment and health, so we have a better picture of the aftermath of the wildfires and how to best inform practices and policies in a way that enables our community members to stay safe and healthy over this long road to recovery. This is just an example of a data portal with information provided for another study with a community partner, which has been useful to them for their communities in taking care of their own health. For more information about these data dashboards, please visit this website here. So I'm happy to say that our website for learning more about Maui West is live at this URL, mauiwest.info, where eligible participants can start signing up. In fact, we currently have about 200 people already registered. Participants must be adults, 18 or over, have resided or worked in the areas affected by the wildfires, so this can be in Lahaina, Kula, or upcountry. Planning to continue living on Maui for the next 5 years, and would be willing to participate in the annual follow-ups. Over the next few weekends, starting this Friday, we are scheduled to be at the Cameron Auditorium in Lahaina, the Royal Lahaina Hotel, and planning on additional venues in Kula. So please visit the website for more information and updates on these locations. Again, we hope to enroll 1,000 participants, which is currently our capacity.
So, however, due to a lot of feedback we've been getting from the Community Advisory Board in particular, we realize there is a great need and urgency to include children first responders, as well as volunteers who help with the cleanup. It isn't for the lack of interest, of course, but really the limitation is funding. We estimate it costs us about $1,000 per participant per year to conduct this study. But as mentioned, we also provide a service to the community members as they participate in the study. So in fact, about 70% of the budget, so $700 per person, is given out directly to community with an incentive for participation, the point of care and specimen testing results we provide to them, and in supporting the community organizations that help us facilitate the study. So the funds for that research really go a long way to support the community while helping us collect much needed information that can be used to make informed decisions for protecting from potential hazards and better protecting for future disasters. So our ultimate goal is to mitigate the risk and prevent adverse long-term health outcomes. So mahalo for your attention. A big thank you to the Hawaii Community Foundation, Maui Strong Fund, and the many community partners who not only have supported the study, but more importantly, have been there for the community from day one. So our efforts are dedicated to them and to the affected participants with the goal of facilitating a quicker and more efficient recovery through the power of data. So now let's hear from these invaluable community partners.
Okay, members, I do want to acknowledge that we have the majority of our Health and Homelessness Committee here, but we also have joining us at the table Representative Ellie Cochran from Lahaina. Representative Cochran, did you want to just say any words of introduction?
Hi, and mahalo, Chair Baladi, for inviting me, and it's wonderful to have your folks' efforts being pushed forward here, and here to learn and see how we can actually apply this in real time. I really appreciate you folks coming into the community and outreach and gathering this data and information, which is so critical to our future decision making. But you know, living there every day and on the ground, I see the needs now, not next year, 5, 10, 20 years down the road, but instantly now. So I'd really like to see how what you gather in real time is also applied real time. But of course, data collection is important for the future. So thank you very much and having me here to participate.
Members, I'm going to allow, I would like to hear from our Zoom participants, and I wish we could have you here, but first up we have Veronica Mendoza-Jakowski. Oh, okay, sorry.
Veronica can talk.
I did want to acknowledge Dr. Bonham, but we'll go with Dr. Bonham first, and then if we can get our Zoom participants ready, it would be first up the representatives from Roots Reborn, followed by Maui Medic Healers. Go ahead, Dr. Bonham. Sorry about that.
No. Thank you, Chair Bellotti and Vice Chair Takanouchi, and I appreciate the comments on the need, immediate need, and that's actually a big piece of why we're doing this. So, you know, UHERO's mission is to do research on all facets of sort of the pressing issues facing Hawaii, from environmental concerns, natural resource management, obviously health concerns, obviously economic concerns, and this falls squarely in that. The reason for doing that is to inform decision-making, private sector decision-making, individual decision-making, business and government, nonprofits, and actually all of the research that goes on at UHERO is very much supported by the community. Hawaii Community Foundation is a large supporter, and without them, this project wouldn't have already gotten to where we are. This project is really kind of an extension of what we learned during the pandemic, which was that we simply don't have the data that we need every time there's an emergency or a disaster, whether it's a wildfire, a pandemic, a volcanic eruption that wreaks havoc on a community, or flooding. We don't have the capacity to quickly bring to bear the information that you need to inform everything from housing support to food support to education support and health support. And so during the pandemic, actually, Alika and Ruben did incredible work to understand community responses and to inform policy. And out of that, in part with support from the legislature with federal dollars, we launched a program that we called the UHERO Rapid Health Survey, that the goal was to maintain a cohort of survey respondents, of individuals that would allow us to have a representative sample of the state's population, where we could because we're interacting with them on a regular basis, we could quickly go to them to get more information. We're in the process, actually with HCF support again, of growing that cohort. The goal there was to build the capacity, right, at the university to quickly gather the information that we need for decision making around health, economics, social concerns, and Maui West is really an extension of that, building on that effort to build that data capacity and to do it so that you can have an impact on the ground right away. And actually, there will be an impact on the ground right away because of the immediate feedback that participants will get on their health, right? They will know that day some results and will get results ongoing that can then help them with their providers to treat if needed. So I just want to thank you for listening and for considering supporting this, because this really is one of the best examples of public-private partnerships you can come up with. We have this enormous community support in the form of HCF and all of the supporters of UHERO. We've got grants into the National Institutes of Health to fund things going forward, and hopefully some support from the state to keep this going long term. Mahalo.
Thank you, Dr. Bonham. I want to just make a quick comment. Thank you to what you're doing, because post-wildfires, I know that the House engaged in a number of working groups that tapped your university's resources to help inform some of the decision-making. But one of the things that was left out, because we had to be so focused on the physical needs of individuals, was this health aspect. And so one of the important things is with the follow-up now and to be able to spotlight it, we really want to kind of avoid the mistakes that were done after other big tragedies that we've seen, like 9/11, where they created health registries years after the disaster happened and really needed to start to capture folks closer to the incident of disaster. And so that's one of the reasons why it's important for us to be talking about this and engaging it now, because it's the health impacts. It's going to be the human services effects of this disaster that's going to persist, that we have, as lawmakers, have to be concerned about. So on that, I know that I want to manage our time a little bit. I know Dr. Bonham has a hard stop at 9:45 to leave. I'd like us to hear a little bit from our Lahaina partners before we open up to questions, because I want to really get the context of why we need this kind of effort, this kind of partnership between government and researchers and community. So first up, we have, I believe, a representative from Roots Reborn. If you could turn on your screen and introduce yourself.
Hi, everybody. I'm Hennessy Ski. Okay, so I just wanted to speak on behalf of Roots Reborn. We are a grassroots organization born in the aftermath of the Lahaina fires. We serve the immigrant community, including our Kofa migrant community. It is a fact that at least 32% of Lahaina residents were foreign-born, almost double the national average. In our work and our lived experience, we see a multitude of barriers that I'd like to bring your attention to. Lack of trust, exclusion from social services, language access, lack of assistance through application process, and outright discrimination. I'd like to first condemn Dr. Ruben Juarez and Dr. Alika Mauna Kea for designing their study to address these barriers. Trust is established through partnerships with grassroots organizations like Roots Reborn that have diligently built connections and have worked hard to earn this community's trust. This collaboration allows us to enhance participation within underrepresented populations. Additionally, the presence of leaders such as Dr. Juarez and Dr. Mauna Kea, who visually and culturally resonate with the communities they aim to include, fosters a sense of trust. Personally, I can attest that within the Latin community, having Dr. Ruben Juarez as a co-lead instills confidence, as he belongs to our community. And this sentiment is similarly echoed for Dr. Alika Mauna Kea. It is crucial, nay, essential, to have Native Hawaiians leading recovery efforts, particularly in the context of long-term health studies. 2, exclusion from social services. So in the recovery aid process, marginalized groups are excluded from resources. Maui West is making it a goal to enroll Latinos into the study, and this inclusion is not seen elsewhere. 3rd, they are overcoming the barrier to language access. In the recovery aid process, we often see a lack of communication to folks who have limited English proficiency. This study, the website and intake form, is already available in Spanish. And I know that there are efforts to expand on that. We have personally helped them translate some material into Pompeian and Chuquis as well. The fourth barrier is support, like handholding. So studies have shown that the more support we can provide in accessing social services, the more these programs are successful. We can attest to this in our work. When we provide direct assistance, they're more likely to receive aid. The study is doing a phenomenal job at overcoming these four barriers to ensure the commendable nature of the study. It lies in a proactive and comprehensive approach to addressing crucial barriers that often hinder marginalized communities from accessing necessary resources and support. This study has made it a goal, again, to enroll Latino individuals into the study. In doing so, Maui West is actively working to counteract the historical trend of exclusion that marginalized groups face during the recovery aid process. This targeted effort not only acknowledges the underrepresentation of certain communities, but actively seeks to rectify it, promoting equity and inclusivity. Overcoming the language barrier is a significant achievement. Many recovery aid processes neglect individuals with limited English proficiency, leading to miscommunication and exclusion. The translation of the study websites and forms into Spanish demonstrates a commitment to breaking down language barriers, ensuring that a broader audience can fully comprehend and engage with the study. The acknowledgement and implementation of direct support mechanisms, such as the provision of assistance akin to handholding, align with studies that highlight the positive correlation between support and program success. Maui West recognizes the importance of not just offering resources, but actively assisting individuals through the process, enhancing the likelihood of successful engagement with social services. The study's commendability also stems from its holistic approach to addressing multiple barriers simultaneously. Rather than focusing on one aspect, it acknowledges and tackles issues relating to trust building, representation, language, and support, creating a more comprehensive and effective framework for community involvement. So in summary, the study is commendable because it goes beyond the conventional norms and is actively working to create inclusivity, accessibility, and supportive environment for marginalized communities during this recovery aid process. So that's all I wanted to say. Thank you.
Thank you, Genesis. Please stay online for us. If we can go to Nikima Glatt and Noelani Ahia of Maui Medic Healers Hui.
Aloha mai kako o Noelani Ahia ko Uenoa no Wailuku mai au. I am the co-founder of Mauna Medic Healers Hui, who deployed to Mauna Kea in 2019 and protected and took care of the protectors up there for a good 8 months. And we created our sister organization, Maui Medic Healers Hui, in the aftermath of the Lahaina fires. We deployed on August 10th, and we were some of the first frontline medical responders that were on the ground even before the Red Cross and the Department of Health were there. Since that time, we've been able to treat thousands of people in our community for every imaginable scenario, whether it's mental, emotional, physical, or spiritual. Most of us who have been on the ground have friends and family who lost their homes, or they lost their homes themselves. This is a very grassroots-based organization that's Kanaka Maoli led and intends to treat everyone with care and compassion, but with a central focus on our Kanaka Maoli because of the historical trauma that puts us in a category of having the highest health disparities in our Pai'aina. We have been in the majority of the hubs since the very beginning, and from mid-September until late December, we were providing medical and mental health care alongside Healthy Mothers, Healthy Babies to the impacted families during the reentry process. So our folks suited up in full PPE every day of reentry and went in risking their own health and their own safety in order to provide that type of very sensitive and very trauma-informed care to our residents as they went back to find closure. Our community is hurting. As you all know, there's been irreparable harm, but this study gives us an opportunity to look at working towards the restoration of Pono for Aina and for her people, as they're inextricably linked. One of the things that I appreciate about this study, and And Dr. Alika's work on this is that he's coming at this with an indigenous methodology to make sure that it's not extractive in its use of data, and make sure that the care and the protection and the health and well-being of all of our Lahaina residents is centered, especially our indigenous population and our populations of similar oppression, including our immigrant population, as well as our unsheltered population. I have to make a side note, since it's a topic of your committee, that our previously unsheltered in Lahaina have been treated horribly. We have disabled, unsheltered people who are back on the streets. We've got double amputees who have no place to go. And this is a result of both the state's policy as well as large organizations like the Red Cross. It's been very difficult working to help protect these very, very vulnerable individuals. And so I'm hoping that this study will also work to get care and protection for those individuals as well. I fully support expanding this study. I don't think that there is anything more important right now than making sure that the health and well-being of all of our people is uplifted and that our community is protected going forward. And as an organization, as a grassroots organization with roots in Lahaina, we will make it our kuleana to make sure that this data is used in a way that we can take care of these residents from a holistic, integrative medicine perspective, as we do in all of our work. So mahalo nui. I'm going to pass it over to Nikki McGlatt, our medical director. Mahalo.
Hello. I'll make this a little short because I know that we're a little short on time, but my name is Nikki McGlatt. I am the mother of a 17-year-old who attends Lahaina Luna High School right now above the burn zone. I'm also a nurse practitioner who lives and works in Lahaina. I was in Lahaina when the fire started, and I have been serving the medical needs of our community in Lahaina since the day of the fires. I was introduced to Noi and her team when they were first medics to arrive, when they were allowed to arrive on the scene with supplies and various medical providers to care for our survivors. I currently serve as a medical director now for the Maui Medic Healers Hui, and I'm co-investigator on the Maui West Research Project with Dr. Ruben Juarez and Dr. Alika Mauna Kea. To me, it only makes sense to expand the Maui West study to reach all members of our community, including children and our first responders. We have treated our old babies, infants from young ages to displaced elderly. I think it's crucial to ensure healthy outcomes, foster resilience, and learn what it takes to build resilience, to educate communities around the world and how to better mitigate the impacts from future wildfires that are going to be inevitable, unfortunately, but also the health risks associated. No one should be left behind. I think we really need to cover the entire area if we can, everyone. We've treated first responders, we've treated our own volunteers, we've treated each other. Our team has treated me, I've been treated. It only makes sense to expand. I think it's important, and I think it would be foolish not to. Our communities deserve public education on all of this, follow-up care and guidance through the inevitable health complications, both immediate and long-term. Our communities have suffered enough trauma over the past few months. So supporting the expansion will ensure our residents are safe, healthy, and get the long-term care follow-up they need. But most importantly, I think that this study is going to give hope to our communities that a better future is coming. Thank you.
Thank you, Nakima. We have time for Kyle Ellison from Malama Kula, and then we're going to wrap up with Dana Moore from Hawaii Healthcare's Huian Alliance. And I think we're going to have some time, especially from Dr. Bonham before he leaves. And of course, members will be able to continue beyond 9:45. So next up, Kyle Ellison.
Good morning. Thank you for having me here this morning, and thank you to everyone for putting this study together. I know we're short on time as well, so I will make it quick. I'm the executive director of Malama Kula, which is a nonprofit that was founded in the wake of the Kula fire here on August 8th. The fire actually started at my house, and I started the Kula Hub volunteer recovery here in the wake of the fire. And unlike Lahaina, in Kula, people have been living in and amongst the burn zone for the entirety of this event. I know there are places in Lahaina as well that are on that fringe zone that have been living in the fire zone this whole time. And so we never had a re-entry. We have just had people living here within feet of burned properties since August 8th. We've actually been doing a fair amount of testing ourselves thus far. Just to give you some background, the EPA, the only health results or the only testing that was done here in Kula in August was August 23rd by the EPA that did some internal testing to develop that they submitted to OSHA for their own internal PPE standards. And it wasn't until October 17th that a report came out talking about the level of toxicity in the ash. And it wasn't until the end of September, it was 7 weeks that passed from the fire until soil tack application in phase 1 of the EPA, which is to say that for 7 weeks, you had this heavily toxic ash that was freely drifting all around the community where people were still living, here in Kula, as well as in West Maui that were adjacent to the burn zone. I'm here to testify this morning that I fully support the expansion to children and first responders and volunteers, because in meetings with Department of Health with Dr. Kenny Fink, he admitted, well, not admitted, but he did say that the area of highest concern would be children, considering the amount of lead that has been consistently detected in all the testing that's been done. We did some independent wipe tests ourselves as well of homes that were still standing adjacent to the burn zone. And this is after the clean, during the debris removal process of the phase 2 cleanup here. And the wipe tests inside homes were still returning levels of heavy metal testing that were mildly concerning, including lead. I'd put one more thing in there, that the testing has consistently been put up against OSHA standards, and we are advocating that the HUD standard should probably be used as opposed to OSHA, considering that OSHA does not take, it's only between the ages of 18 and 65, and we have a lot of residents who are either under 18 or over 65 who are living 24 hours a day, not 8-hour days in this burn affected community. So and I think it is very prescient and important to do this study and get ahead of it. So I support the expansion to children and first responders and volunteers, because we had volunteers on the ground from day one breathing everything here while it was all freely drifting around. So thank you very much.
Thank you, Mr. Ellison. And Dana Moore from Hawaii Healthcare's Huion Alliance, or representative. Dana, your camera is not turned on. All right, as we are waiting for that, members, I'd like to open up for questions as we're waiting for Dana to come on. Again, we do have Dr. Bonham here for another 15 minutes. We have, go ahead, Chair Martin.
Okay, thank you. I'm wondering, what will the control or comparison group be, or will it be this same cohort at an earlier point in time getting their health data?
Yeah, that's a great question. We actually have, because it's a longitudinal study, the individuals that we collect initial baseline data for will serve as their own controls, and then we expect that there's going to be a spectrum of differences within that subgroup so that we can rely on cross-sectional analysis. But in addition to that, we do have other cohort studies from which we collected similar data that we can use as a baseline unaffected control population to compare that with.
Just to give you an idea, so we have 2,100 individuals that we just finished recruiting for a different study, and it's basically the same metrics that we are collecting. So those are the controls.
And can I ask another question?
Yes, go ahead.
So, and is it just first come, first serve, or first register, first serve, or how do you recruit your sample, like that?
Fortunately, yes. I mean, that's the way to do it. I mean, so we partner with community organizations, they disseminate the words, and then we have a capacity of 1,000 people, right? And after that, we have to close the study.
Yeah, and we encourage those that initially enroll in the study to also refer individuals in their own social networks, family members, friends that might be eligible to join in as well.
Any other questions? And if Dana, if you could email our technicians. Okay. All right. Go ahead, Representative Ilagan.
Thank you. On your slide, when I added slide
microphone.
3. Thank you, Representative. On your slide 3, I added up the percentage on your demographic. It's up to 150%. So I'm not sure exactly how this all adds.
Yeah, because there are multiple.
But yeah, so if you could explain that later. The other part is, I noticed the higher demographics are Filipino and immigrant residents. Are there any way to ensure that the profiles of the ethnicities that are a greater percentage taken into consideration in the health impact study?
Okay, so I'll explain the percentages first. So there is a lot of overlap. Some of them are like
Multiple
ages,
races.
right? So, but if you count, if anti-immigrants, right, it's 31%. So if you count only the races, that's less than 100%. So slightly less than 100%. So the second question about the immigrants, yes, absolutely. So we are hoping to partner with community-based organizations that target Filipino, and we've been doing that actually. So yes, we'll make sure that there is a representative sample of the population in Lahaina.
But that also speaks to the value of expanding the size of the cohort, right? As it makes it easier to get that representative sample.
Any other questions? Representative Kobayashi, I can always count on you for questions.
I hate to put a damper on this, but I go back to the earlier comments about needing help now. 10 years is a very long time. You have a small sample of only 200 now. You have some treatment efforts going on. You'll have so many confounding variables. And if there are people with severe problems, they might not emerge immediately. And so I'm wondering if more effort might be put toward accessing services, providing care, rather than trying to do what is an academically interesting, useful study.
Okay, I'll handle that. So it's probably my fault for not being clear in my presentation, but we're actually covering both the immediate short-term impacts as well as the long-term impacts. In my presentation, we are actually including information to communities that are participating in the study, so that allows them to learn about their own health immediately so that they can get support. And we actually provide them a wraparound service, so connect them to specific resources in the community that are relevant to cover that support. In addition to that, the long-term strategy is to look at some of the changes over time as symptoms are, develop. And so we can learn about how the initial impacts from the result of the wildfires might have impacted that long-term effects as well. And they'll also be getting information at that point in time as well. So it's both. We're covering the immediate as well as the immediate short term as well as the long term. And we're also not just limited, it wasn't 200, actually it's 1,000 participants that we're targeting, at least in the scope of our study, where we have funding for, but we're hoping to expand that to include as many as we can, as funding allows, so that we can get a better picture.
I'm going to complement actually that, because one of the things that we do, so as soon as the participant come into the study, right? So they complete all the health metrics, including some blood tests, a spirometer to look at like lung health. And then at the end of the study, on the same day, they actually get a sheet that says, hey, these are the results that we got today. This is what we can tell you today. And then, this is elevated. Maybe you should go and see your provider immediately. So there is basically this information that is being given to participants immediately. On top of that, there is the academic aspect, as Alika said.
Dr. Bonham, if you can respond, and then I have some questions if others don't. Okay,
So
Dr. Bonham.
just to follow up on what Alika said, was that they've got 200 people signed up just because the website has gone live, right? They haven't even done any in-person registrations yet. And so my guess is that with the right funding, we could easily have many more than 1,000 people participating, which would be very, 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 very helpful, both in the immediate diagnoses and providing information to these people and care, but also in tracking them so that we make sure we don't miss long-term health problems. One last point was that there's been a lot of talk about first responders and community, but no one has said anything about workers. I mean, people who, as part of their job, I mean, yes, firefighters and police officers, but also people who have been delivering food, who have been working on utilities. All of those people are experiencing exposure, some of them lots of exposure.
Representative Takenouchi, then Representative Garcia, and then we'll go second questions for Representative Martin. Go ahead.
Thank you, Chair. Hey, sorry, quick clarifying question. Sorry if I missed this in the earlier presentation. So when we talk about this expansion, understanding that, more funding would just allow us to expand. But when we're talking about these groups, especially the first responders and children, is there like a base number that you would need for that data to start being useful when we start talking about expansion? And what's that number?
Yeah, so, I mean, we need at least 500 children to be able to do that. So we're hoping that we can get obviously to more children. I mean, for every adult, ideally recruit 2 children, which is like the average family. But yeah, first responders, I mean, I don't know, Alika, what is the statistical significance? I don't think we have computed that. But it's adult individuals, basically. Yeah.
This is going to be a continuing conversation, so you can get back to us with that information. Representative Garcia.
Thank you, Chair. So you mentioned about 1,000 so far participants. What's the goal to get your ideal sample for the accurate information? What's the goal?
2,000 actually.
2,000.
We started with 2,000. Due to funding limitations, we actually had to go to HCF and we had to cut it to 1,000.
Okay.
And right now we're hoping to expand it potentially to 2,000, which is what we ask.
Okay, cool. And then lastly, they mentioned earlier the HUD standard versus the OSHA standard. What is that?
Wait.
That would be a question for Mr. Ellison, and the request that the study maybe, or actually all of the agencies be applying the HUD standards versus OSHA standards as we move forward in recovery.
Yeah, I can answer that real fast if you'd like.
Go ahead.
Yeah, so you basically covered it there, that HUD being the Housing and Urban Development Standard for heavy metal toxicity inside of homes, because thus far the EPA that has been administering the air quality tests and has been doing a lot of the health related testing oftentimes is using standards for OSHA, as if people are working in the work zone, not living in the affected burn zone, but people that are working in a workplace safety environment rather than a housing environment where you're spending more than 8 hours per day. Also because OSHA does not include children. Again, it's designed for ages 18 to 65, and as we know, elderly and young children will be more vulnerable to some of these potential exposures than workforce ages between 18 and 65. So just, putting the narrative out there that we should be looking at HUD standards for people living in their homes versus a workplace environment as we're monitoring these and reporting on these health risks.
Thank you, Mr. Ellison. Any other comments on that question?
Yeah, and Kyle raises a really good point too, because we know about maybe the environmental factors that might be contributing to the effects, but we don't know how much of that really is contributing to the individual level and how much of it's getting under the skin, so to speak, and how that might create not only the short-term effects that people have been, coming to care for, but of the long-term effects that would have, and definitely vulnerable in children and older individuals as well for those types of exposures.
Thank you.
Representative Martin.
I'm wondering about, I understand that a lot of like emotional anxiety, et cetera, that kind of thing we would see probably immediately. But for the toxicity, what would the expectation be for seeing the impact or seeing negative, morbidity, health outcomes of that? Would that be within the time of your study range, or would that be much longer?
No, that's a great question, actually. So it varies. So it's really complicated, but because it depends on the amount of exposure, how often a person is in those areas affected by that, you can actually, certain samples that we would take can actually have long-lived, long-lasting toxicants people can be exposed to over a longer period of time, and we would be able to detect that in some cases if it's high enough. Those that have been already sort of it depends on how your body metabolizes those things too, right? Because we do have mechanisms internally that actually helps us cope with those things. But if it's too much, right, it's at a certain level, then that causes conditions, right, downstream. So we'll be able to at least assess the variability of those exposed to these environmental toxicants potentially across that population. And then we can identify how much of that might be linked to these short or long-term health outcomes. And so really that's a study question that we'll like to address from this type of cohort. And that's the only way that we can really do that, is to have this type of comprehensive data from participants and then look at the differences between them and study that over time.
Sorry, what was the total time of the study?
We intend it to be 5 years, but actually we're hoping to extend even longer, beyond 10 years.
Because wouldn't some of the concerns be like cancer?
It could be much longer. Yeah, exactly. So we don't.
That can take 10 years, even more.
Right.
Right. Representative Ilagan, question.
Thank you. The data from this health study is going to be great. And I just wanted to ask you, have you considered your hypothesis, your foresight, or what you foresee from this study considering implementation? I know there could be policy, it could be funding that's needed, but have you considered the fact that we could leverage the data for federal funds, and what are some of those considerations?
Yeah, so we are actually seeking federal support for getting additional funding to get the study launched, but also to expand it at the same time. So the idea here is just to get initial information as much as we can to then expand on that study result, the study, so that we can cover as many people as we can. The other part of that is we would like to use that information, and actually I think this goes back to Carl's earlier conversation about how we can use this data to link it to not only supporting individuals on the ground as they experienced it, but also identify sort of what are the weak points and what are the areas where we can actually improve on, which specific metrics do we really need to collect in response to these types of events at an early, as fast as we can, in order to then make decisions, quick decisions that then help protect people from these hazards going forward. I mean, the simplest things that you could think of, for example, is like, of course, PPE, right, when you're visiting those burn zones. But then if for those that don't have that, or may not think that that's needed because, it's up in the air, then we would collect that data to understand, well, how much of that is really getting at the individual level, right? Identify specific biomarkers that could be useful for detecting these vulnerabilities, so that we can encourage these kinds of policies and implementation of those practices to help support, and mitigate those risks. So it'll be the data we envision here that we'll be collecting will be comprehensive enough to help inform those types of decision making.
But we have not already looked at, say, federal support for mitigating some of the health concerns, right? I mean, I think that's a really good question. But if we don't, if we don't understand what they are and we don't have the data on what the exposures are, we can't. Not only can we not deal with it right away, but we also can't seek support from federal agencies to help offset those for long term.
Dr. Bonham, I just want to remind you, 9:50, and I know that you have another meeting. Yeah. So is there any final questions for Dr. Bonham before we let him go? Or do you want to make any closing comments? And then I do have some questions.
I'll make one. I'm not sure that we made it clear that we are also gathering, questionnaires also include information about socioeconomic issues and demography. And so one of the things that we're doing with the Rapid Health Survey is we're combining data on health outcomes with data on housing and other socioeconomic characteristics. That's really important to understand all of the effects, not just the health effects. And I just want to thank Ruben and Alika for the amazing work that they're doing.
So you're welcome to stay and leave when you need to, but I do have some questions, members. Any other questions? So in front of us, members, we have two handouts, one on the community registry and one on the cohort study. And I really just want to make sure that we understand the difference between the two, because there's actually a request to really fund two of them. The cohort study already, as I understand it, has partnership funding from Hawaii Community Foundation and this wide network of folks that you have. That is the more costly a study, and as you continue to look for funding, certainly you can come to us, but that is also just a more kind of intensive study, right? Can you explain the difference between again, just to highlight, what is the difference between the registry and the exposure study, and potentially how the registry can capture more folks even though it might not be providing as much of the services?
So I think the main difference is active data collection versus passive data collection. So in the study, right, Maui West, so participants come over, provide biomedical samples, health exams. We enroll them. It's pretty expensive, actually. It's about $1,000 per participant. Just $700 of that is medical tests and things like that. On a registry, people come over, they register. Sometimes they give us access to the medical records if they want to. But more importantly, we can follow these participants over time. So there is no collection that we do from them. But if we access their medical records, if we have a new study, if we have information that we want to send them, for instance, the Department of Health is interested in providing information to these participants, we can contact them. So our experience is that these two actually work hand in hand. So the first study will allow us to do assessments, so interventions, to speak, that we could potentially do to the entire group. Okay? If we don't have the registry, then we won't be able to effectively send information to those participants. So we're hoping that we're able to fund both of them.
Okay, and I know that, without much advertising, you've already had 200 participants. This weekend, you will actively go to Lahaina and to places where survivors are. I would actually expect that you're going to hit your 1,000 mark pretty quickly. Yeah. So is the registry then a place where if you hit what you need and have funding for, then they will slide into the registry? Is that the idea?
Yeah, the registry is independent from the study, so those that would maybe not want to sign up for the study, they can participate in the registry just to be getting information to be followed up on. And it would give us a better idea of what's the situation over the larger population that's been affected versus where limited in terms of the funding and the scope for the particular study that they would not be able to participate in. So that at least is another way to kind of capture information outside of from that group.
And to capture information immediately. Can you speak to why it's important to capture it now? Again, I just want to really emphasize, I feel like, and I hope that we are modeling something that maybe other states have not done, and that why is it significant for us to be doing this now?
Yeah, exactly. I mean, that's, we wanted to capture it now. We learned from lessons from 9/11 that that's a huge delay in terms of responding and identifying those risks. I mean, we didn't know about years later that the aftermath of that tragedy had an impact on cancer risk, for example. So the only really identify that is to track it as close as we can to the event. And especially as things change for individuals, right? A lot of them have left those areas. Some of them are living on different islands or out of state. So it's important to capture those individuals before those changes happen, so that we know who's been affected and how we could serve those affected populations better.
If there are any more questions, I do want to ask Dana, are you available to speak? I do want to give you that opportunity. I know that you're with Hawaii Healthcare's Hawaiian Alliance.
Yes, hello, can you hear me?
We can hear you. I'm glad that we were able to connect. Go ahead.
Oh, aloha, and I call on I'm having tech issues. My camera's not working. But I just want to say aloha and mahalo for this opportunity to share how the Maui Wildfire Exposure Study can benefit Maui. So my name is Dana Moore. I'm a Kanaka Maoli and a nurse. I was born and raised on Maui, where my roots are. Maui is the only home I've known. And today I'm here on behalf of Hawaii Healthcare's Hui, which is an active arm of Hawaii Community Health and Safety Alliance. We've been active in the critical pandemic and fires response. And I've been involved in assisting Dr. Pang of the Maui District Health Office in the reentry process, giving PPE, education, and doing mental health screenings for Lahaina. So our Hui is Hawaii-based nonprofit bridging community members and leaders in health advocacy, resources, education, and support. We contribute to health equity by identifying needs among many populations, including Kanaka Maoli, Asian Pacific Islanders, and underserved segments of the population. We actively respond to the fire disaster on Maui by coordinating between subject matter experts, licensed healthcare professionals, multiple nonprofit relief programs, and community-based organizations on Maui, in Hawaii, and from the mainland. Our mission is to work together with community partners and Hawaii leadership to educate, advocate, innovate, and take actions to promote health and the well-being of Hawaii communities. Advocacy for the Maui wildfire exposure study is supported broadly across the health community, and data collected from the UHERO team and partners can be used by local organizations, healthcare providers, health advocates, leaders, and policymakers. This data will inform decision makers and help direct resources to improve supports and systems that serve our Kanaka Maoli and members of the community. Early warning can alert our healthcare providers so that treatment and interventions can be provided. This opportunity allows for participating individuals who have been affected by our Maui fires to be empowered and active in the care of their health. By supporting the expansion of this study to include first responders, volunteers, and workers who are exposed in the burn zones, and especially our keiki, we have the opportunity to impact future generations in perpetuity. Our Hui supports this work and is actively involved in creating locally sustainable solutions. We are highly concerned about the exposure to toxins from fires, which will impact the long-term health of our people and our environment. The research to be done has potential to be used as a model nationally, making Hawaii a health leader in effective response to large-scale disasters, which affects keiki education and well-being, public health, socioeconomics, and creates impact from trauma, lack of stable housing, and limited access to timely and comprehensive health care. In conclusion, Hawaii Healthcare's Hui is honored to support the Maui Wildfire Exposure Study. We are dedicated to helping Maui Nei through our long-term recovery. Mahalo for your time, and our Hui is sending aloha to all who are impacted by the Maui fires.
Thank you, Dana. Any further questions for our panelists, either on Zoom or here in front of us, Dr. Juarez and Dr. Manakea? Of course, Chair. We have lots of time. There's no hearing after this.
So you're asking, the bill is asking for funding for the cohort study. What about the registry? Is that already funded?
No, actually, we have no funding for the registry. Do you want to explain?
Yes, okay. Members, just as a bit of context. So this piece of legislation was actually born on opening day when I had been thinking about some of these things, but we had reached out to some advocates at the American Lung Association and other folks in the community, and then we connected on Saturday, this past Saturday, and this bill was written based upon my initial meetings with Dr. Juarez and Manakea. So the bill in front of you, members, is going to be introduced, and I'll circulate it. It has not yet been circulated. I'm going to circulate it to all in the House. It's my fault, completely my fault that I did not include the registry in here. So this is going to be hopefully the vehicle that we can use at this point, just because we're now at deadlines. But because of the broadness of the title and our ability to, excuse me, the broadness of the title and our ability to kind of work on this, because we really have to really flesh out and understand who are the other partners in this process to make sure that we have a very, a tighter request of the Finance Committee. So this is a work in progress, but I did want to provide this to you folks.
Thank you. And I was glad to see the 20 years. I feel like that will capture more types of morbidity. Thank you.
Members, any other questions or comments? Representative Cochran?
Thank you. Just real briefly, I went to the site. I was just trying to find the hours that you'll be in attendance at Cameron Center and Royal Lahaina.
9 to 5.
9 to 5? Okay. I was just, because I want to make sure I'm there.
Awesome.
Thank you.
All right, I'll just make some closing comments. First, thank you to all of our Zoom participants. Thank you for your advocacy, for your work in the days, minutes, hours after the wildfire. I think we are very concerned about all of the impacts, and this committee will especially be concerned about the health impacts and see what we can do to continue to help support the efforts, because we know that this is, again, a human services disaster that is 5 years. that will be with us for 5 to 10 years. Members, again, as Chair Martin pointed out, I did want to point out to you that we do have that bill. This will be, as we move forward, we'll be looking at both the registry and the study. I'm happy to report that I think, there already is community partnership and funding and support for the cohort study portion of it. But certainly, as you guys continue to roll out and see what the numbers are, there might be needs for more funding. I will also report to the committee that, we will be working in concert with our federal delegation. I was able to speak with Congresswoman Takuda on the floor, and I just dropped it in her ear that, look, there is this health impact studies that we're looking at, and what can we do, because this is going to be able to help those rural communities as we continue to face these kinds of problems. And so I know that we're going to have a great partnership with our congressional, our county partners, and with the community. So I really want to say mahalo to Dr. Juarez and Dr. Manakea for leading this effort, for pulling together the community partners that you already have, and that we will be continuing this conversation as we head into session. I will leave it to you to make any final closing comments, and then we'll adjourn. Dr. Juarez? Dr. Manakea?
No, thank you again for having us, and we look forward to working with you.
Just mahalo ya'o ko pau. Really appreciate all your efforts here, your diligence, and we really are looking forward to heading to Maui this week and really helping as best as we can. Mahalo nui.
All right. Members, we are adjourned.